I do want to talk a little bit more about what an addiction really is, because I think we oftentimes think of addiction as being something like an illegal drug. But the truth is, you can be addicted to a lot of things. Wine, fatty, sugary foods. It could be drugs, but it could be a whole host of other things. Well, what's happening? Well, in your brain's pleasure centers, anytime you're doing this thing, it rewards you. You get a flood of dopamine in your brain's pleasure centers. And over time, you'll see inside the brain here, you start having more and more dopamine. Well, the brain responds to that in an interesting way. All this dopamine tells you, just like with the radio when it's turned up too loud, you turn down the volume. So here's a brain jacked up on dopamine because I've been drinking too much, eating too much food. So your brain actually turns down the volume, so you have to drink even more or eat even more just to get back to a state of normal. Because when you're not doing these things, your pleasure centers aren't being stoked. You don't feel pleasure. Have you ever noticed how people, when they quit a substance, they're angry, they're depressed, they're unhappy? Well, this is the reason, because before long, your brain relies on the drug to make you not only feel good, but to stop you from feeling bad. So this is all a matter of reward centers in the brain. And when you become addicted to a medicine, you are just trying to get that pleasurable feeling, to not feel so bad anymore. And that's why it's a sad scenario, because once you're addicted, it's so hard to stop.
Well, then here's my question to you guys, just from a biochemical point of view. Should you cold turkey it, or is that the worst thing to do because of that chemical withdrawal? Like, how do you recommend physically withdrawing from these substances?
Well, it depends on the substance, and it also depends on the person.
Question.
Yeah.
How, because each addiction is going to be a little bit different. But in general, you have to wean somebody off any given addiction.
I'll give you some examples of ones that you need to be weaned off of. If you're a true alcoholic, to the point where when you stop taking in alcohol, you develop seizures or something called delirium tremens. That is a life-threatening condition. So in the hospital, we will give people medicines to almost mimic alcohol in the body and slowly wean them off of it. Same thing can be said for, we've heard of heroin addicts who, you want to potentially go cold turkey, but there's all these physiologic responses making it more difficult. Now, food addiction. If you're addicted to fatty and sugary foods, you can't stop eating food, but you can quit that cold turkey. There's not going to be any problem in your body from doing that.
Right. And for some people, stopping smoking cold turkey is the best thing, but like in Steve's instance, he says when he stops, he feels sick, so maybe he needs to wean off with a patch or something like that.
And the best treatment options are multi-pronged. So if you can get counseling, and sometimes you may need a medication, but if you can also get support from your family and friends, because these addictive personalities, they tend to push the limits. And so if that limit happens to be drugs or alcohol, it could lead to a lot of problems down the road.